Hi, I'm Dr. Doug Ehrenberg, and I specialize in pulmonary and critical care medicine. One of my particular areas of interest is the prevention of lung cancer, and nothing is more effective than helping people stop smoking. As medical professionals, the interactions we have with our patients who use tobacco can have a profound impact on their willingness and ability to quit smoking. And the good news is these pivotal visits don't have to add a lot of time to your already busy schedule. It really boils down to 3 tasks: identifying smokers, motivating them to make quit attempts, and supporting them with guidance and pharmacotherapy. I like to think of every smoker who comes to Michigan Medicine as experiencing a chain of contact with our health system. A chain is only as strong as its weakest link. Medical assistants or rooming staff are often the first link in that chain. They're responsible for recording the smoking history in the social history section of the encounter for later verification by you, the provider. We've created a video for medical assistants to help them know what information to gather so that you, the next link in the chain, can easily take over. The final link is the clinic nurse, who provides follow-up care, medication refills, and answers questions often long after the visit has been completed by phone or by portal message, for example. We've also created a video for nurses to help them understand and perform their tasks. I want to emphasize that your role in this chain doesn't have to add a lot of time to your visit. It's more about the quality of the interaction than the quantity. Smoking cessation is very hard. It's an addiction, which means it's a chronic problem and difficult to treat, but difficult doesn't mean we shouldn't try. In fact, many smokers cite a physician's advice as one of the main motivations to quit in the first place. In general, smokers already arrive at their doctor's office with their guard up, afraid they're going to be judged. Most are well aware of the dangers to their health. I believe that no matter what it is we're trying to convince our patients to do or not do, we're more likely to be successful if they sense genuine empathy. You can't fake sincerity, so it really helps to understand the true nature of nicotine addiction. So I'm going to point out some often overlooked facts about tobacco that really helped me increase my empathy for my patients who smoke. First, I want to dispel the notion that smoking involves an ongoing choice. Nearly every adult smoker started smoking as a teenager. More than 80% of smokers report they had their first cigarette before the age of 18, and did so because of the tobacco industry's highly sophisticated and well-funded marketing strategy, developed and refined over decades. The teen brain is not wired to make decisions based on long-term risk, and the tobacco industry knows this. Nicotine addiction happens very quickly after initiation of smoking, and once addicted, there's no choice. It's an ugly trap. Nearly every pleasurable effect of smoking described by smokers can be attributed simply to the relief of symptoms of nicotine withdrawal. Understanding smoking as nicotine addiction can help you convey genuine compassion and support when you say to your patient, "You need to stop smoking and I can help you, and what's more, I know you can do it." For patients who are resistant or ambivalent towards a quit attempt, the evidence suggests that motivational interviewing helps overcome this resistance. And once again, this doesn't have to take up a lot of time. Motivational interviewing is an effort to bring out someone's intrinsic motivation to change their behavior. In tobacco treatment, it refers to overcoming a smoker's ambivalence towards quitting, and when done well, it can significantly increase the number of quit attempts made by patients with a tobacco addiction. I'm going to go over some examples of commonly encountered patient responses. Keep in mind that this is a chronic, relapsing disorder, so you should expect that you'll need to repeat discussions with your patients. This could take some time, so if you're pressed during a clinic visit, you have a couple of choices. You can ask your patient if you can refer them to a tobacco treatment specialist, or you can make another appointment devoted to talking about smoking cessation. When you do have the conversation, you might encounter a patient who says, "I don't want to quit smoking." But data tells us that more than 70% of smokers do want to quit. Many of them, though, lack the self-confidence or self-efficacy to make the attempt. They often feel guilt over smoking, and this guilt can manifest as a stiff resistance to talking about quitting. One successful method I use to encourage a willingness to talk is to share a sort of us versus them attitude towards tobacco. Specifically, I talk about how the tobacco industry engineered this product to produce and maintain addiction. I found that statements like this often open the door and patients are more willing to let their guard down. Another thing I like to point out to patients is that nicotine withdrawal causes stress, anxiety, even fear. Nicotine relieves these symptoms and can provide a feeling of relaxation and a false sense of security. Talking to patients frankly about this can help them see that you understand what they're going through, that you actually get why it's so hard for them to quit. Some patients might say, I quit for a while, but I started smoking again. It's important for us to remember that relapses are the rule, not the exception. We should expect that many of the patients who stop smoking will start again at some point. First, reassure the patient this doesn't make them a failure. The message we want to consistently send is don't quit quitting. If patients have cut down, congratulate them on their progress. Second, find out why the patient returned to smoking. Quite commonly, it has to do with stress. Tobacco provides a false sense of comfort by triggering the brain's natural reward pathways. Helping patients understand that nicotine-induced comfort is both fleeting and false might prevent them from seeking that relief through tobacco. Be clear with your patients that stress is a natural part of life. Try to emphasize that the next cessation attempt should include strategies to deal with stress before it happens. Having a plan for managing stress can prevent further relapses. Another objection I've heard from patients is, I'm ready to quit, but I don't want to use medication. Many smokers are resistant to using cessation pharmacotherapy, but these drugs really do work and dramatically increase the odds of success when smokers are trying to quit. You can go to this resource for a chart that lists current tobacco cessation medications, their side effects, how to prescribe and manage them. The cost of medication might be an excuse given by some patients, but in reality, the cost of these products is less than what they spend to sustain their smoking habit or to deal with the health consequences of continued smoking. In many areas, a patient can call a toll-free quit line where free medications might be available. When it comes to quitting, whatever method they've used, you might hear from some patients, well, I tried it before, but it didn't work. It's helpful to talk to patients about what they've done in the past. When you know their stressors and triggers, previously successful attempts can be used again with a strategy to avoid triggers, or alternative pharmacotherapy can be offered. At the end of the clinic visit, the next person in the chain of contact, your clinic nurse, comes into play. Follow-up phone calls have been shown to increase long-term quit rates and are also a great way to assess how the patient's doing. In my own clinic, I create a note during the encounter and I route it to my nurse. This note includes any important information needed for follow-up, as well as a request for them to call the patient 2 to 3 weeks following their visit or 2 to 3 weeks following a quit date if one has been set. This connection to the clinic staff is crucial to keeping the patient committed to their goal. As humans, we're more likely to follow through when we know we're accountable to someone for our actions. Thank you for taking the time to watch this video. Nicotine addiction is a battle we can help our patients win when we have the right processes in place and the right attitude towards their success.